Now, how do you know that it's GAD versus just regular worry, like all of us have, right? Well, one way is that, that the worry with GAD is difficult to control. I mentioned that already, right? You go to a movie and you don't have GAD, you can probably put your worry aside and focus on the movie. With GAD, that's kind of hard to do. The second thing is GAD, the worries with it are, it sort of goes like with the first one. They're harder to get off your mind. They're more distressing, longer lasting, and they usually occur without a trigger. So there's not necessarily, it doesn't always have to be something that kicks it in. It can just be just that you kind of worry a lot. By the way, if I have a spouse or a family member in the room and I'm trying to take a history, a lot of times the person won't really realize this or they won't admit that they worry a lot. But I just ask the spouse, I just say, is he or she a worry wart? That's kind of how we refer to it here, I guess, in our society. Are they a worry wart? Have you guys heard that before? And, not that I'm going to make a diagnosis on somebody saying that somebody's a worry wart, but, it gives me a little clue anyway as to what might be going on. Another thing about regular worry versus GAD, the more life circumstances a person worries about, the more different things they worry about, the more likely it is to be GAD and not just regular worry. I mean, all of us worry about, meeting our bills on time, or, I don't know, putting food on the table, is our job secure? I mean, these are all things, these are kind of, I don't want to say normal, but common things to worry about, and it doesn't mean you have GAD. So here's the case outcome in this case, okay? Patient's family doctor diagnoses generalized anxiety disorder, and or GAD, sorry, and refers the patient for psychotherapy. She learns about the disorder from reading and talking to the doctor and the therapist. She learns to challenge some of her anxious thoughts, and you can do this CBT therapy and do the same thing basically. What's the likelihood that you're going to die in the plane if you go down, if the plane goes down? And you bring in some numbers and you say, here's how many people have died from a plane crash in the last year. 0.001 per million or something ridiculous. It's very, 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 very small. And you try to get them to start thinking through some of these irrational fears and things that they have. So that's the therapy. The medication is continued for 6 months, but with therapy she's able to wean it off and control the anxiety without it. The medications really are the same ones we talked about before, the serotonin medicines, which take a while to work again, and they may not completely get rid of the anxiety, but they make it so it's less frequent and less severe, so that you can function better. And then the other type of medicines then are the nerve pills, and we sort of talked about them already. Takes us to 2 minutes till the hour. Can you believe that? Any questions about any of this stuff? Yes?
I came to hear you say one word and you haven't said it yet.
What's that?
It's a gland in your brain, starts with an A.
Amygdala.
A, thank you.
Yeah, the question was, there's a gentleman that I used to work with, and he used to, he likes to hear me say weird things. So the part of the brain that I was saying that causes, it's like a reflex, boom, you have this fight or flight reflex and it kicks off without you even thinking about it. That part of the brain, or that amygdala, is part of the brain that's involved in that reflex. It's kind of a primitive part of the brain. It's, in general, things that are deeper down inside the brain are things that have been there for longer, and the things that we humans have that are different are the things that are up farther and then out farther. So like the frontal parts of our brains are more developed than the animals. So those are the parts we use to think through things and all that. Yeah?
You repeat again, Dr. Henley, you said on a panic disorder, a person could have panic attacks but not have panic disorder.
Yes.
Tell me again, what the difference is, or what would make it panic disorder if they've had 5 or 6 panic attacks within an amount of time?
If they've had 5 or 6 panic attacks in their life and they're 35 years old and these panic attacks have been every 2 years or something like that, and they've just had one, not had any for a long time, and they're not afraid of having another one necessarily, that's not panic disorder. Panic disorder is a recurrent thing over and over again. These things are, and like I said in the case, it's kind of classic. These folks, without treatment, it gets worse. They get 3 or 4 of these things a day, and and then they have to have the fear of having another one. That also makes it panic disorder. So the fear of having another one and the repetitive, unexpected panic attacks really makes panic disorder. Yeah?
Hives, what about that?
Hives can, yes. It's very interesting. Yes. Some people, I haven't seen as much with panic disorder.
You didn't have on your list.
No, it's not in the criteria. These criteria are, the diagnostic, the DSM it's called for psychiatry. It's how we diagnose things, and it has the criteria. And so hives aren't in there, but I have seen it a lot. And actually, I think I see it more with this GAD than I do with panic. At least I had in my experience. I don't know about other folks, but there's hives are caused by a histamine release. There's probably a reason for that. I'm sure there is a reason for that. I'm trying to think what it might be. Why would you want a histamine release? I'd have to look it up. I can't remember what all the things that histamine does. But this is an antihistamine would treat that. But it is kind of common, yeah. Other questions? Different things about anxiety. These are good questions.
Are these things genetic as well as some of the others?
Yes, I didn't cover that.
Brain disorders.
I didn't cover that, but yes, the question is, are they genetic? And I should have put down some numbers on that. I wish I had some for you. They're not. It's not like 100%. So it's not like if you have both parents that have panic disorder, every single child is going to have panic disorder. That's not. And really, in general, that's psychiatric disorders aren't like that. What's been shown though is that there is a higher risk if you have a parent, either one or the other parents that have had one of these disorders or some type of anxiety disorder. I'm not sure it really matters which type, but if there's some type of anxiety problem in the family, it makes it more likely that you would be at risk for that. Now, why isn't everybody at risk for it? It's not so simple. It's not like anxiety. It's not like any of these psychiatric disorders have one gene that if you inherit the gene, you have the disorder. It's not so easy, like Huntington's disease or something like that. I wish, but it's not. So that's what makes it difficult. There's probably some interaction between your environment, growing up, and your genetic blueprint of your brain, and then eventually what you're exposed to in life. So if you have a very traumatic childhood and you have a genetic risk to have anxiety, that's probably the worst possible scenario, because then your brain develops growing up thinking the world's a scary place, right? If you're getting beat on or you get sexually abused or something like that, or it can be even something like not having enough food to eat, or moving all over the place because your folks are having a hard time with keeping a job or finding a job, that kind of thing. Those things can be very stressful for a child, and then so their brains their stress response system and everything develops thinking the world's a dangerous place. But they're also at risk to have anxiety disorders because maybe their amygdala is a little bit too active, more active than it should be, and boom, those two things together, then they get exposed to some stressor when they're an adolescent, a teenager or something, and it kicks off an anxiety disorder. So that's one possible, I'm not guaranteeing that's what happens with everybody, but that's one possible scenario. Any other questions? Good crowd, good questions. I appreciate it, guys. Thanks for coming. Next time, we got through all this today. I was pretty surprised. Next time I'm going to talk about post-traumatic stress disorder, obsessive-compulsive disorder, and we're going to use letters for these things next time. I'm not going to say them over and over again. What's the other one? Social phobia, or social anxiety disorder. Those are the things. So PTSD, OCD, and social phobia. I'm going to try to do all three of those in one session. We'll see. Pat's laughing. Yeah, knowing me, I'll get one done or something. We did better today than I thought. So, any other questions about the brain, about anything? It doesn't have to be about anxiety disorders. It can be about anything. Free access to a shrink. Of course, nobody wants to say anything in front of everybody else.
I'm a friend of a friend of a friend.
That's right. That's right. I get that a lot.
What part of the brain did you say these occur in? I know you said that, whatever you said, like what lobe?
The amygdala, I think, is in the temporal lobe of the brain, and it's a deeper part of the brain. It's more of a primitive, because animals and everything have it. So it's the part of the brain that gives you the reflex part, and then of course it connects up with the higher parts of the brain, and so you're able to learn from whatever happened. Right? That's what I was trying to get at before. So that would probably be the prefrontal cortex. Prefrontal means, here's the front. Pre means right before the front, so right in here. And that's the part that helps us learn new things and stuff.